We continue discussing Peter Attia's Outlive, and this is the fourth part of the interpretation. The focus of this section is on the leading cause of death in modern times. Cardiovascular diseases, manifesting as heart disease and stroke. In the United States, 2,300 people die from these diseases every day, surpassing all other conditions, including cancer. If you're curious about how you might meet your end, cardiovascular diseases seem the most likely culprit. However, Peter Attia believes we have effective means to shift cardiovascular diseases from the top cause of death to a lower rank. Maybe even the 10th cause. The key is early intervention. Very early intervention. When people talk about heart disease, they often mention symptoms like chest pain, left arm pain, and shortness of breath. However, these are not the most common symptoms. They represent survivorship bias. The most common symptom of heart disease is sudden death. Most heart disease patients don't get a chance to communicate their symptoms to a doctor. Stroke, fundamentally a cerebrovascular disease, results from cerebral vascular obstruction, causing effects ranging from mild paralysis to fatal outcomes. A person in their 70s had a heart attack due to anger, a person in their 40s, usually not engaging in physical activity, had a stroke from lifting heavy objects during a move, and a person in their 30s worked continuously for several days, resulting in sudden death. People draw lessons and say, "Oh, never get angry, take it easy with exercise, and don't work too hard. We should pursue harmony between humans and nature, maintain the balance of life." These are all erroneous attributions. Their illnesses don't stem from anger, exercise, or exertion, but from atherosclerosis. Their cardiovascular systems are already compromised. It's just that the symptoms become apparent during an episode. Avoiding an episode this time doesn't mean it won't happen next time. It's an inevitability in progress. The trouble is, as long as symptoms don't manifest, you almost feel like you're perfectly fine. Atherosclerosis typically shows no symptoms, and even if it's detectable through tests, people tend to overlook it. In the US, approximately 1/30 of women die from breast cancer, while 1/3 die from diseases caused by atherosclerosis. Yet, society's emphasis on breast cancer far exceeds that of atherosclerosis. Even more confounding is that atherosclerosis isn't a result of specific wrongdoing. In the previous section, we discussed the metabolic system, highlighting how even if you don't smoke or drink, the abundance of food in this era damages the metabolic system. While that could be considered a personal problem, the situation here is different. Even if you do everything right, atherosclerosis can still occur. Let's dispel a myth. Many people believe atherosclerosis is caused by high cholesterol. A long-standing misconception. Earlier theories suggested that cholesterol-rich foods would accumulate bad cholesterol in our blood. This cholesterol would accumulate on the arterial walls, leading to blockages, akin to pouring oil down a kitchen drain, causing it to clog over time. In 1968, the American Heart Association specifically pointed out high cholesterol in eggs, and recommended reducing egg consumption. This notion has persisted, and some still avoid eggs. However, decades of research have shown no direct correlation between heart disease and egg consumption. The reality is that the vast majority of cholesterol ingested from food is excreted. Most of the cholesterol circulating in our blood is produced by our own cells. In 2015, the advisory committee providing dietary guidelines to the U.S. government finally acknowledged that cholesterol is not a nutrient of concern for overconsumption. So, the good news is you don't have to worry about eggs anymore. The bad news is you can't solve the problem by adjusting your diet. Cardiovascular diseases arise from a flaw in the human design. This is a tale of systemic decay. This process does involve cholesterol, and some recently discovered longevity genes are related to cholesterol. However, the key is not cholesterol itself, but the carriers. Specifically, apolipoprotein B, ApoB, which packages cholesterol into transport particles. Cholesterol is essential for cells, but can't be transported directly in the blood because it doesn't dissolve in water. The body must package it in lipoproteins to form small spheres, like packing it for delivery. There are two main types of these spheres: high-density lipoprotein, HDL, and low-density lipoprotein, LDL. HDL, with apolipoprotein A, ApoA, mainly carries cholesterol molecules for removal. LDL, with apolipoprotein B, ApoB, carries cholesterol to tissues. You only need to know about these two carriers. The problem doesn't lie in cholesterol itself, but in these two vehicles. Both types of spheres in the bloodstream may collide with blood vessel walls and penetrate the endothelium. HDL spheres, upon entering the endothelium, leave again, while LDL spheres are prone to getting stuck. It's not just LDL. Several other lipoproteins can cause atherosclerosis. However, the outer layer of all these lipoproteins is ApoB. ApoB-wrapped spheres are prone to getting stuck on the endothelium, highlighting a design flaw in the human body, similar to a car with a part prone to wear and tear. Let's focus on LDL, which, once stuck, triggers a chain reaction, ultimately leading to the breakdown of the cardiovascular system. Firstly, when the spheres get stuck, they oxidize, producing toxicity. Then, these trapped LDL spheres attract more LDL, creating a positive feedback loop. Seeing an accumulation of LDL, endothelial cells summon immune white blood cells, called monocytes, to deal with them. Whether the LDL is oxidized or not, monocytes can consume it, transforming into macrophages, playing a cleaning role. But macrophages, after consuming LDL spheres, become larger and can burst, turning into foam cells. If the endothelium is covered with many foam cells, visible fatty streaks form. These streaks grow into plaques. After the age of 15, the arteries may already harbor some plaques. As plaques expand, they may breach the endothelium, and foam cells may leak out. To seal this breach, smooth muscle cells from the arterial wall migrate over, acting as if healing a wound. However, this is only a temporary solution. The endothelium keeps generating new foam cells, and the area covered by plaques and scarring becomes larger, gradually occupying the blood flow channel and narrowing the vessel. At some stage in this process, the plaques on the endothelium calcify. This is a self-protective measure to mend gaps, but calcification also implies hardening. A cross-section of a vessel in this image illustrates the entire process. The golden circle represents the endothelial cells of the blood vessel, and the blue and brown spheres are fresh and oxidized LDL, respectively. The green cells are macrophages, and the yellow ones are foam cells. The story unfolds between the endothelial cells and muscle tissue. This image is a real cross-section of a blood vessel with atherosclerosis, where foam and plaques are clearly visible. It might be a bit intimidating. This is a precarious situation. The next step is the unstable, calcified plaques may rupture, forming a blood clot. If the dislodged clot travels to the heart, it can cause a heart attack. If it goes to the brain, it can lead to a stroke. An essential condition for all this to happen is inflammation in the endothelium. Smoking, high blood pressure, and factors mentioned in the previous section. Visceral fat, insulin resistance, uric acid, etc. can easily lead to inflammation. Inflamed endothelium is more prone to trapping LDL. A seemingly calm person sitting in an office for prolonged periods, not engaging in physical activity, may appear to be aging gracefully. Little do they know that their coronary arteries have partially blocked due to hardening, and their circulatory system is barely maintaining itself. One day, if they suddenly engage in vigorous exercise, demanding an increase in blood supply, problems occur. Either due to insufficient oxygen delivery, leading to ischemia, or due to poor blood flow, causing infarction. The external manifestation is either a heart attack or a stroke. This person dies, and upon pathological examination, when the blood vessels are cut open, they are found to be dilapidated long before. The process of atherosclerosis is very slow, but it's not just an ailment of old age. Due to various reasons such as genetics or inflammation, many young people also face this problem. When considering the onset age of adverse cardiovascular events like heart attacks and strokes, half of men and 1/3 of women experience them before the age of 65, with 1/4 of men having them before the age of 54. Some scientists even believe that this process may begin in late adolescence, during the teenage years. Because of the role of LDL spheres, people often refer to LDL as bad cholesterol and HDL as good cholesterol. This is inaccurate. The key lies not in cholesterol itself, but in the ApoB as the outer layer. However, HDL is indeed good because it may take away foam cells when entering, and leaving blood vessel endothelium, extracting cholesterol from macrophages, thereby maintaining endothelial integrity and reducing inflammation. But its effect is limited. ApoB also has an accomplice called LPA. This is another lipoprotein, similar to ApoB in function, making spheres prone to getting stuck on endothelial cells. Its impact is mainly related to genetics. Conventional checkups find it challenging to directly detect atherosclerosis. A calcium scan can assess the extent of vascular calcification, and CT angiography can visualize plaques before calcification. However, the point is that by this time, atherosclerosis is already on its way. Common and more advanced warning indicators include checking LDL concentration, a parameter present in your medical test results. However, research shows that LDL's predictive ability is not robust. I understand that lower LDL is generally better, but having high LDL doesn't necessarily mean more cardiovascular issues. Attia focuses on two indicators. Levels of ApoB and LPA when examining patients. Studies indicate that for each standard deviation increase in ApoB, the risk of heart attack death increases by 38%. From the mid-20th century to the present, the mortality rate from cardiovascular diseases has dropped by 2/3. Modern medicine has indeed made some achievements. But if you wait until the disease manifests to seek treatment, it's already too late. Prevention is better than cure, and the earlier, the better. Attia believes the general principle should be to reduce the presence of ApoB, meaning lower LDL concentration, and lower overall blood lipids, comprising various lipoproteins. As mentioned earlier, a problem with the metabolic system is that insulin transports excess sugar into the bloodstream, turning it into fat. Some research suggests that as long as LDL concentration doesn't exceed the level physiologically necessary, atherosclerosis may not occur. Attia recommends pharmaceutical intervention, commonly using statin drugs, to lower lipid levels. Some people may experience side effects from statins, and there are alternative options. There are even suggestions to add statin drugs directly to drinking water, similar to adding fluoride to tap water to improve dental health. This approach is evidently too radical, as it could have side effects. Attia himself is proactive in using medication, so at the age of 50, his cardiovascular disease risk is even lower than at 36. His goal is to reduce ApoB concentration to that of a child. I cannot guarantee whether Attia is correct. It's the first time I've heard that healthy individuals should also take medication to lower lipids. And as far as I know, obtaining statin drugs requires a prescription from a doctor. So, you should discuss it with a physician. But the principle of early detection and intervention is undoubtedly correct. In the next part, let's talk about the cancer.
If you feel there is value in this, please like, subscribe to this channel, and leave your thoughts or suggestions in the comments section. Let's grow together and read more good books.